Hey there, Jessica here. If you're new, welcome. If you're old, welcome back. Please subscribe as I am starting to put out new content fairly regularly. All right, so for those of you who don't know me, I'm a therapist in Austin, Texas. I make educational content related to the world of mental health and also to my specialties, which are sleep issues, chronic pain, radically open DBT, PTSD, and OCD. Alphabet soup. I also send out a monthly newsletter, so you can subscribe down in the description. So, what I wanted to do today was just make a quick little video demystifying the alphabet soup of all these letters that you see after the names of mental health professionals. So specifically, I want to talk about the differences between the different types of providers that you're going to encounter if you're looking for mental health care: psychiatrists, nurse practitioners, psychologists, therapists, coaches. What's the difference? So I'll talk first about psychiatrists. So psychiatrists are physicians. They're medical doctors. They're going to have MD or DO after their name. So a psychiatrist went to college, got a 4-year degree, then went to medical school, which I believe is an additional 4 years. Then they did a residency after they finished medical school, specializing in psychiatry. Psychiatrists can prescribe and manage medications. They can order labs. They do doctor things. It's pretty uncommon anymore to see a psychiatrist who does therapy. There are some, but they're pretty few and far between. So it's mostly going to be medication management that you're seeing a psychiatrist for. So your first appointment with the psychiatrist might be 45 minutes to an hour as they're getting all of your history. But after that, you'll typically have maybe a 15-minute like med check appointment and then go on your way. You might see them every month. You might see them every few months, depending on how you're doing. So that's a little bit about psychiatrist. There's also psychiatric nurse practitioners. So these people are going to have PMHNP after their name, which stands for Psychiatric Mental Health Nurse Practitioner. So typically, a psychiatric nurse practitioner went to college, did a 4-year degree, and then did a master's degree in nursing or something in that vein. Some psychiatric nurse practitioners have a doctorate in nursing, and they can prescribe medications. And then, of course, primary care physicians, family doctors, OBGYNs, internal medicine, they can prescribe mental health medications. So they're also an option. So, which one do you need? Well, I always love to say that if you ask a therapist a question, the answer you get is it depends. And that's the answer here. So, all these providers, psychiatrists, nurse practitioners, and primary care doctors, they can all prescribe medications. Some states have limitations on nurse practitioners, what they're able to prescribe. Maybe they can't prescribe controlled substances like Adderall or Xanax, or maybe they're prescribing under the supervision of an MD. This varies from state to state. I guess I would say in general, primary care doctors and nurse practitioners, it kind of depends on what your needs are and how complicated things are. So less complicated, I think a primary care doctor or a nurse practitioner can handle that adequately. The more complicated the cases, then I would recommend getting in to see a psychiatrist. And it's kind of like, that question of a generalist versus a specialist. At what point do I need a specialist? So, as far as managing medications, psychiatrists, nurse practitioners, and family doctors slash primary care doctors, there's different types of doctors that are primary care doctors. That is who can prescribe and manage medications. Then there are other providers who don't prescribe medications, but can provide other types of mental health services. So, psychologists. So, these people are going to have PhD after their name, or you might see PsyD, which is PSYD. So, they again went to college, did a 4-year undergraduate program, and then usually I think they go straight into doctoral programs. You might also see EDD. That's not as common, but there's also psychologists that have those letters after their name. So psychologists are excellent diagnosticians, in my opinion. They get a lot of training in what we call in the field differential diagnosis. So if you ever watch the TV show House, they did a lot of differential diagnosis. Him and his team would be like, okay, we've got this patient, they've got these symptoms. Um, could it be this? Could it be that? Why is it this? Why is it that? And really trying to like nail down what is the diagnosis. Okay, so I'll also give an example from my area of expertise. So I treat a lot of insomnia, and always in the back of my mind, if I've got somebody coming in saying, I have insomnia, I can't sleep, it's always in the back of my mind. Is this insomnia or is this a circadian rhythm issue? Because they look very similar, but the treatments are a little different. And so I would say that psychologists are really, really good at that. Psychologists can also offer a service called psych testing, which is useful for a lot of different stuff. It's useful for like diagnosing learning disabilities, assessing cognitive function. I've seen people get psych testing done if they suspect they have ADHD or autism. And psych testing is very much outside the scope of my practice as a social worker. So if any psychologists happen to be watching this video, and want to leave a comment below filling in the gaps in my knowledge, then feel free to. But that's psychologists. There are some psychologists that have prescribing privileges. I know that's a thing. I have not encountered a psychologist who prescribes medication, um, but it is a thing that exists. All right, so now let's talk about therapist. So therapist is a generic term that covers several different professions. So when someone says they're a licensed therapist, if you really want to get into the weeds, they're not a licensed therapist per se. They're a licensed social worker or professional counselor or marriage and family therapist. So many psychologists are also therapists, as a lot of psychologists provide psychotherapy. And then other professions that call ourselves therapists are social workers, LPCs, which stands for licensed professional counselor, and LMFTs, which stands for licensed marriage and family therapist. So social work, LPC, LMFT, all of these people have master's degrees. So again, went to college, did a 4-year undergraduate degree, and then got a master's degree either in social work or counseling or something kind of in that vein, or marriage and family therapy. So I am a social worker. I did my undergrad, my bachelor's is in sociology, and then my master's is in social work. And then I sat for an exam after I graduated to get my LMSW, which stands for Licensed Master Social Worker. A lot of social workers don't go anywhere beyond that. A lot of social workers, if you don't want to be a therapist, then there's not really a need to go beyond that as far as licensure goes. So there's social workers doing all kinds of things, working in government, working in policy, working in schools, hospitals, lots of stuff you could do with the social work degree. But once I started working, because I wanted to be a therapist, I wanted to pursue that kind of work. While I started working, I also started a 2-year supervision plan that, when completed, allowed me to sit for a second exam to get the license I currently have, which is LCSW, which stands for Licensed Clinical Social Worker. So that LCSW allows me to independently diagnose and treat mental illness. So I can open up a private practice, I can bill insurance, I can work independently. And there's a similar process for people who are LPC or LMFT. So they're going to have LPCA or LMFTA. And then once they do the supervision and sit for the exam, then they're LPC, LMFT. You might also see LCDC after somebody's name. That stands for Licensed Chemical Dependency Counselor. So that means they specialize in substance abuse. Now, you don't have to have an LCDC to provide substance abuse care. There are people who are competently working with addiction who don't have LCDC, but a lot of people who have that specialty will want to go ahead and pursue that other credential. So an LCDC, a lot of LCDCs also have other licenses like social work or LPC. alphabet soup, I know. But somebody who is just LCDC, their education kind of ranges. They might have anything from an associate's degree to a master's degree, and requirements are going to vary from state to state. So the differences between LCSWs, LPCs, and LMFTs are pretty negligible in my experience. One is no better equipped to do therapy than the other. Kind of like I said before, social work is a broad field. Not everybody who gets a social work degree becomes a therapist. Um, LPC training, my understanding is it's a little more narrowly focused on going into private practice. But any LPC who happens to be listening, please feel free to correct me if I have that wrong. But I think they're a little bit more focused on, because they're going to be counselors, like they're going to do therapy, whereas social work could do other things. LMFTs, licensed marriage family therapists, do tend to look more like the whole family system or the relationship, but there's overlap. So social workers tend to think in systems. We also get training in family systems kind of stuff. LPCs can be employed in areas other than private practice. Not all LMFTs work with couples or families. So as far as that goes, I don't know that I would recommend one over the other. Really, the thing that's going to make the most difference is, do you have a good, solid relationship with that person? So you really want to find somebody with the proper training and experience to meet your needs. So I have specialties, listed those above. And that also means there are other things that I don't do because I don't specialize in that. So if somebody were to come to me and they're looking for treatment for substance abuse, I would refer them to somebody who specializes in that. If they're looking for help with an eating disorder, I would refer them to somebody who specializes in that. So you really want to look for somebody who's got the training and the experience in your area. So like my area is sleep. One of my areas is sleep. I've had quite a bit of training and some consultation specifically in sleep issues. So I'm very well equipped to treat that, but I would not be well equipped to work with somebody who has an eating disorder because there's a lot I don't know about eating disorders. And I would want to send that person to somebody who knows a lot more than I do. So finally, what about coaching? I was coaching different from therapy. So there's similarities and differences. There are therapists who also do coaching. Sometimes what I'm doing in session is sort of akin to coaching. Ideally, they would be offered as distinct practices. So a therapist who does coaching might have two different businesses set up or two different consent processes for therapy and for coaching. So, a couple of differences. A therapist can diagnose and treat mental illness, a coach cannot. So, a therapist could assess you and say, yes, you have depression. Yes, you have an anxiety disorder. I am diagnosing you with this, and here's the treatment. Coaches can't do that, aren't don't have the are not considered to have had the expertise or the training to do that. Coaches tend to be more focused on here and now and moving you forward. Therapists might look a little bit more into your past. And I also think if therapy alleviates emotional suffering, coaching is really more about like, what are your goals? What do you want your life to look like? Although you can see how there's some gray here. Um, a lot of the therapy that I do is much more focused on here and now and moving you forward. But I am a therapist. I don't call myself a coach. Coaches aren't licensed. There is a certification through, I think, the International Coaching Federation, but it's not required to be a coach. Therapists are licensed, and the whole purpose of licensure is to protect the public. So it doesn't exist to protect me. It's to keep me from doing harm to somebody. So if I do something unethical, if I do something inappropriate, there's a licensing board that somebody could report me to, and then the board would investigate. So with a licensed professional, you have some recourse. Now, there are excellent coaches out there. I do not want it to sound like I am just bagging on coaches. There is sort of this natural tension, I think, between therapists and coaches. There's some wonderful coaches out there. I've referred clients to coaching. Um, but know that with coaching, you are not they might have that certification, but there's no sort of requirement through the state that they follow any sort of like ethical guidelines, anything like that. Okay, so I hope this provided some clarification about all these different letters after the names of people if you're looking for mental health care. So please like and subscribe if you found this helpful. I'm also going to link to a blog post in the description that talks a little more about that. All right, I think that's it. Thanks for watching. Bye.